Hello and welcome to this episode of On Geriatrics. Today we shall be talking about the role of the medical social worker in geriatric care. Who is a medical social worker? A medical social worker is a healthcare professional who helps patients and their families navigate the social, emotional and financial challenges that come with a medical diagnosis, a chronic illness or injury. So they hold a Master of Social Work degree, which is usually a 2-year postgraduate degree after graduation. So they serve as a bridge between the medical team and the patient's life outside the hospital, ensuring that the transition from the clinical care to the home is safe and well supported. Their services are available in the inpatient, outpatient, as well as in the community settings. So as I said before, their focus is on the family, finances and the environment and their impact on the mental and physical health of the older person. So they act as advocates for the older person in various settings and are their emotional anchors. They look for and help mitigate elder abuse, both psychological and physical. Abuse is not just physical. Often the elders feel neglected, or the caregivers or the family members may not pay particular attention to the elderly, and that is also a form of abuse. And these kind of things should be identified as early as possible and mitigated. And the medical social worker is the prime person who does this. They also deal with caregiver stress, the person looking after the older person, be it daughter, son, another family member, or most often it is the spouse of the older person who himself or herself is old and often not in the prime of health, who is looking after this old person, and they are prone to be stressed out. And it is very important to identify this and prevent that kind of stress in the caregiver, so that the older person is taken care of and also the caregiver is taken care of. So we always say in geriatrics, there is a patient behind a patient, and that patient is the caregiver, who is usually the spouse of the patient. Then elderly, as we grow older, our life is replete with losses. Loss of a loved one, loss of financial independence, etc., etc. So grief is often a phenomena that is present in the life of an older person, and grief counseling is often needed, and the medical social worker is in the prime position to provide that grief counseling. Then the medical social worker also helps navigate insurance related issues. As you know, in today's world, it is very, very difficult to manage without insurance. So there are insurance provided by the government as well as insurance provided by private players. So the medical social worker helps the older person and their family to deal with insurance related issues. They also help the older person to prepare in advance how their end of life should be. In other words, advanced medical directives, where the older person specifies what is it that he would like and what is it that he would not like to have should he reach a stage where he is in a coma or he is unable to make his expressions clear. Then every individual, every patient has a right to refuse medical treatment. So long as he or she is competent, mentally competent, he or she can always refuse medical treatment if he or she does not want it. And so does the older person. So if the person reaches a stage where he or she is not able to express this, he can put these things in writing so that this can be followed by the patient's family members as well as the doctors who are taking care of the patient. So this is another important aspect which I shall be elaborating in a future episode, where the medical social worker plays a huge role. then a patient who is in the hospital and is ready for discharge often requires many kind of support once the discharge happens. And the support could be in the form of rehabilitation facilities, both physical as well as mental, etc. So the medical social worker will coordinate with the patient's family members and arrange for facilities which are close to where the patient resides, so that the family members can access that kind of care. So in short, the medical social worker, is knowledgeable about the various private and government facilities available to the elderly and their caregivers, and educate them about the same and helps them access these facilities. They keep in touch with these agencies to facilitate this. With this, I come to the end of this episode on the role of the medical social worker. And as you can see, the medical social worker's role is huge in elder care. In my next episode, I shall be talking about advanced medical directives and allocation of power of attorney. Until then, goodbye.